Hello learners, good morning. In our last ENT lectures, we had discussed the important anatomical and physiological points related to ear. So if you have any doubt, kindly convey. So today in our class, we are going to discuss regarding the diseases related to ear. So first, let us start with the external ear. So, in case of external ear, in anatomy, we had read what are all the parts of external ear. One is pinna and the second one is external auditory canal or meatus, and the third one is tympanic membrane. So, now we are going to discuss regarding the diseases related to all the three parts of external ear. So, let's start. So, here first condition is hematoma of auricle. Auricle is none other than pinna. It is also called as cauliflower ear. Cauliflower ear. Okay. So here what happens? Hematoma, it is indicating the blood collection in the pinna. So here what happens? There will be collection of blood between the auricular cartilage and the perichondrium of pinna, that is leading to this, and here the main causation is trauma. For example, in case of boxers, there will be repeated trauma in the ear that may lead to this hematoma of auricle. In case of, as I told, boxers, then in case of wrestlers, similar event, then rugby players. So this is regarding the hematoma of auricle, which is also known as cauliflower ear, and this is indicating the blood is collected between the articular cartilage and the perichondrium of pinna, and the main causation is trauma seen in boxers, wrestlers and rugby players. Okay. Now moving towards the second condition, that is furuncle, which is a condition related to the hair follicle. So here what happens? Hair follicle, like we know in case of external auditory meatus, we are having the skin up to some extent. So there will be inflammation of the hair follicle leading to the furuncle, and the main causative organism is staphylococcal infection. So staphylococcus family is the main causation for furuncle. Okay. So it is none other than the hair follicle inflammation, and the causation is staphylococcus, and here there will be tenderness. Okay. So now moving towards the next condition, that is diffuse otitis externa. So with the name itself, I think you can identify what it is. Diffuse is all over. Otitis related to the ear. Externa is none other than the external ear. And here this diffuse otitis externa is also called as telephone ear. The person who used to speak more on telephone. Then Singapore ear. Or swimmer's ear. So you must have idea regarding this other names of a particular condition. So swimmers here, I am not going in detail because these are, I am just discussing only the MCQ points which is useful for the examination purpose. So these are all the other names of diffuse otitis externa. So here it is mainly seen in the hot and humid climates. Hot and humid climates where there is problem in the maintenance of pH. Okay. So here what happens, for example in case of hot or humid climates, there will be excessive sweating. If there is more sweating, there will be alteration in the acid-base balance, that is pH, and leading to these type of infection. And here the common bacteria which can be suggested were Staphylococcus, same which we had seen in the furuncle. Here it is particularly Staphylococcus aureus and Pseudomonas. So these are all the causative organism of diffuse otitis externa. So there is one similar condition associated to this diffuse otitis. Let me tell you what it is. That is none other than malignant otitis externa. So with the name we can say that this is somewhat a severe condition to that of the diffuse otitis externa, and here it is also known as necrotizing or invasive otitis externa. Okay, so that one is only diffusive. Here it is necrotizing, which is more deep in the plains, and invasive otitis externa. Okay, so here what happens, it is mainly seen in persons who are having uncontrolled diabetes, like elder people with uncontrolled diabetes mellitus we can see, because already in case of there is uncontrolled sugar levels, blood sugar levels, that will predispose to infections. So now here in case of elderly age group we can see this condition along with immune compromised states. So whenever there is low immunity, there will be more chances of this particular infection. And here the most common organism causing this is Pseudomonas aeruginosa. Okay, so this is important, Pseudomonas aeruginosa. And here what happens, there will be dark purulent discharge from the ear. Yes, if there is any infection in the ear, surely we will get the discharge. So here as it is malignant, there will be dark purulent ear discharge and otalgia. There will be pain in the ear. Otalgia is none other than pain in the ear, and this pain is because of the involvement of seventh nerve, that is seventh cranial nerve, that is none other than facial nerve. Okay, so I am just repeating again. So this malignant otitis externa is somewhat more serious than the diffuse otitis externa, which is also called as necrotizing or invasive otitis externa, and it is seen in the elderly uncontrolled diabetes patient and immunocompromised patient, and most common organism causing it is Pseudomonas aeruginosa, and it is of a dark purulent discharge it has, and there will be otalgia, which is most commonly associated with the seventh nerve palsy. Okay, so now moving on to the next condition, that is photomycosis. Photomycosis. So here mycosis is very clear that it is somewhat a fungal infection. So here the causative organism is Aspergillus niger. Okay. So this is the causative organism Aspergillus niger, and here what we can see on examination we can see wet debris or flakes which resembles a wet newspaper. Just imagine that if there is a wet newspaper staying inside there, how it looks like. So the same way, if the patient is suffering from otomycosis, we can see this on examination. So here 2 points to remember. Most common organism is Aspergillus niger, and we can see the wet debris or flakes in the external auditory canal that is similar to the wet newspaper. So this is regarding the otomycosis. Now moving on to the next condition, that is bullous meningitis. So bullous is indicating somewhat like bulle, that is water collected cavity, and meringa is none other than tympanic membrane. So meningitis is inflammation of tympanic membrane. So here it is completely associated with influenza, which may be of epidemic nature, influenza or mycoplasma, or any viral infection. So if we are examining the tympanic membrane, how it looks like, tympanic membrane will have hemorrhagic blebs. Okay. Hemorrhagic blebs will be there, and they are of very painful nature. So if you are examining, you will get the clarity by looking at this, what is happening inside the ear. And adding to that, after healing of tympanic membrane, how it looks like? After healing, it looks like sago grain, okay, which we use in payasam. So sago grain like appearance will be there. So in case of bullous meningitis, is none other than the inflammation of the tympanic membrane, and it is associated with influenza, mycoplasma and viral infection. And on examination, there will be hemorrhagic blebs which is of painful nature, and after healing there will be sago grain appearance. So this is regarding the bullous meningitis. So moving on to the next condition, that is Ramsay-Hunt syndrome. This syndrome is somewhat more important. You might have heard regarding this. So here in this syndrome, what happens? Herpes zoster infection, herpes zoster, which gets settled in the geniculate ganglion. Okay. So it gets settled in the geniculate ganglion, and whenever our immunity is going low, or in that cases, again there will be, sorry, I was correlating with some other disorder. So in case of Ramsay-Hunt syndrome, there will be herpes zoster infection which present in the geniculate ganglion, and because of this it may lead to lower motor neuron paralysis of facial nerve. Okay. So sometimes we may expect question that in case of Ramsay-Hunt syndrome, whether we will have upper motor neuron palsy or lower motor neuron palsy of facial nerve. So be clear, in case of Ramsay-Hunt syndrome, there will be lower motor neuron paralysis of facial nerve. So okay, this is one of the important MCQ. And while studying regarding the anatomy of ear, we studied that the facial nerve supplies the posterior wall of the external auditory canal. So in case of Ramsay-Hunt syndrome, there will be minor sensory issue in the posterior surface. Okay, minor sensory issue in the posterior inferior surface. and there we may expect some herpetic eruptions also. Okay, herpetic eruptions also. And while discussing anatomy, we had read regarding one important sign related to this particular part of the ear, that is Hitzelberg sign. Hitzelberg sign, where there will be sensitive, if there is any facial nerve paralysis or anything, there will be less sensation in the posterior inferior part. So that is the thing which we are discussing here also. And in case of Ramsay-Hunt syndrome, we can expect some herpetic eruptions also. So the most important thing, that is herpes zoster infection lying in the geniculate ganglion, leading to the LMN facial nerve palsy, and there may be Hitzelberg sign also along with herpetic eruption. So this is all regarding the Ramsay-Hunt syndrome. And one of the confusing condition, that is impacted wax. So impacted wax, it may present exactly like a disease condition. Sometimes it may cause itching or decrease hearing, then tinnitus, that is ringing sound, and there may be vertigo. Okay, so this condition sometimes we used to think which is similar to the some different disease, but it is none other than the impacted wax. So in order to remove the impacted wax, we need syringing technique, which can be done as an OPD procedure. You might have seen in your clinical cases also. So next, we are going to see regarding the perichondritis of pinna. So already we studied regarding the hematoma of auricle. So this is also one similar condition related to it, that is perichondritis of pinna. Okay. So here what happens, the most common organism is Pseudomonas. Sometimes you can make a separate note and write down the most common organisms you are studying throughout your preparations. That will be very easy for you to recollect at the last moment. Sometimes while studying you may feel that I can remember this, but surely at last it will confuse completely. So it's better to write it down in a separate notebook. So here the most common organism for perichondritis of pinna is Pseudomonas, and in case of otitis externa also we had seen this Pseudomonas organism causing the infection. So here what happens, there will be redness on examination and it will be hard, yes, because of the signs of inflammation, and there will be pain, that is tenderness will also be there, and sometimes there may be pus collection also we can expect between the cartilage and perichondrium. Okay, so this is all regarding the perichondritis of pinna. So now moving towards the next condition, surfer ear. So here only one thing you should know regarding the surface ear, what it is also known as. So it is also known as exostosis. So exostosis is none other than abnormal bone growth in the external ear. Okay. It is also called as surface ear. Okay. Now next. Next, important congenital condition. So here the MCQ will be most common congenital deformity of external ear? And the answer some of you might be knowing, and the answer is bat ear. Bat ear, our ear appears like this. So what is happening inside it? So here what happens, there will be abnormal protrusion of pinna. Abnormal protrusion of pinna. And there will be absence of anticalyx. Okay. So this is regarding the bat ear, which is the most common congenital deformity of external ear. Okay. So only one condition is there to discuss regarding the diseases associated with tympanic membrane, and that too not deeply. So if there is a rupture of tympanic membrane due to any trauma rupture, what we can see on examination. So if it is because of any trauma, on examination, otoscopy is the examination tool here, and here we can see the perforation of tympanic membrane. Yes, surely because of trauma there will be perforation. And how it looks like? With irregular hemorrhagic margin. Irregular hemorrhagic margin will be there. Okay. So I'm just repeating, in case of tympanic membrane, if there is a rupture of tympanic membrane because of any trauma, on examination of otoscopy, what we can see, there will be perforation along with irregular hemorrhagic margin. So this is all regarding the tympanic membrane. And now we are moving towards the third part of external ear, that is eustachian tube. So here there is one interesting condition regarding this eustachian tube. Let me tell you, that is patulous eustachian tube. So what happens here? There will be flaccidity of eustachian tube because of some reasons. Patulous eustachian, I am not writing in full, eustachian tube. So this is one of the interesting condition because most common causes of idiopathic origin. So what is leading to the flaccidity? Still now there is no clarity. And adding to this idiopathy, there may be they had seen some association with third trimester of pregnancy associated with, it's not exactly the causation, but it is associated with the third trimester of pregnancy. And few more conditions. If there is rapid weight loss, we can expect. And finally, if there is multiple sclerosis. So in these three conditions, there is common association of this patulous eustachian tube, which is none other than flaccidity of eustachian tube. And here, how the patient will be complaining? Patient will be complaining that they are hearing their own voices. Okay. So here what happens? If there will be autophony, that the patient hears their own voice and breath sounds, which is also called as autophony, if they are hearing their own voice. So this is the abnormality of this patulous eustachian tube, which we had seen in our materia medica in few drugs, that the patient hears their own voice. So this is because of the problem in the eustachian tube. So try to correlate that clinically. So on examination, what we will get? Okay, we are now clear what the patient will say to us. And now on examination, as a doctor, what we can see, so examination is completely related to otoscopy if it comes to the external ear. So in case of external ear, we are examining, there will be movements of tympanic membrane. Tympanic membranes will be along with respiration. So there will be movement of tympanic membrane along with the movement of respiration. So this is more important. So on examination also, now we are clear what we can see. So one more MCQ related to tympanic membrane. That is, if we are testing for the tympanic, the MCQ is related to the test for eustachian tube function. So if we are testing for the eustachian tube function, the best test is tymphanometry. Tymphanometry. So try to remember this, doctors. I am just going very briefly so that you can get the things which you want to study, which you need to study for the MCQ purpose. And now we are ending the diseases of external ear. So if you have doubt, you can communicate to me. And if you have any suggestion regarding the classes, then also you can communicate to me freely. So thank you so much. We will continue next class with the diseases of middle ear.